cancer is a leading cause of mortality and incidence for chronic diseases in our country.
Breast cancer and cervical cancer is a major problem in the Gambia because we do not have the oncologists to support the treatment. And we are very limited in resources when it comes to mechanisms like machines, radiotherapy, comprehensive cancer center, including a comprehensive cancer plan.
Cancer runs in my family. My mother had it, my grandmother has it, my sister has it, my aunt has it. So it runs in my family. So we know what it entails and how expensive it is to treat cancer.
You can prevent cancer. You can treat cancer when you see it at early stage in order to cure people.
Cervical cancer is so much easier to treat. It's all part of the reproductive system, so there's no reason why we cannot have that readily available for women here.
Early detection is key.
The Cancer Association League, the Gambia, was initiated in 2019.
This league was brought about in 2019 when we all decided to come together to form the Cancer Associations League.
Since 2019, we've been in partnership with the Cancer Association League in the Gambia. They're doing a wonderful job. Every year they come with a new initiative, and this year's one I think is exceptional because the awareness that it's created, it's exceptional.
We're very happy today. We're here at Lamtoro Clinic in Kololi. We're hoping to see over 2,000 women who want to get screened in honor of October, which is breast cancer awareness. And we are very, very grateful to partner with our Senegalese oncologist, Dr. Jeng.
We are here with the help of Cancer Association League Gambia in order to screen people, to teach them how they do monthly self-examination breast, and if we see cases which need some mammography or ultrasound, we can use the facilities available in this clinic in order to see further.
We're doing breast cancer screening, so we're doing the breast. They're equipped to do biopsies if there's a case that is suspected.
For some cases we have seen cancer, invasive cancer. We'll try with the authorities to see how we can help them to get treated.
They're also doing cervical cancer screenings, and then if anybody needs further investigation, the plan is to have the doctors come back in about a month to do follow-up visits.
Unfortunately, most cases in our countries are advanced cases, and for these cases we help people to tolerate the symptom of the disease and to try to help them not to suffer with what is named palliative care or supportive care.
We're also working on an MOU with a doctor. Hopefully, will come to terms, and he will be a visiting doctor here in the Gambia because he is the one who treats a lot of cancer Gambian patients actually in Senegal too as well.
As a civil society group, it is our responsibility to also work hand in hand with stakeholders, the Ministry of the Gambia, to ensure that we are all aligned in the fight against cancer. We are all supporting each other in the fight of our lives.
Sometimes we can pick up some conditions, not only cervical cancer, but they have these recurrent infections that they don't want to. Our culture and religion, most women don't want to be seen by men in the hospital, so they will not come.
We need to change the mentality. We need to change the stigma that's already within us. Our culture, I believe, doesn't let us be as open as we should.
Unfortunately, cervical cancer, our women, they don't usually go out for voluntary screening. So it has to be something like this. People are calling for them to come for screening. The time we see them in Banjul is usually very, very late, and we can barely do anything for them. Unfortunately, what we do is to send them to Dakar because we don't have the facilities for radiotherapy or chemotherapy. So things like this are very, very important because for us, prevention is better than cure.
The achievement or the goal is to get as many women screened as possible.
We will also doing sensitization. We will be speaking to women all through the process and also advocating also for more a mammogram machine in the Gambia.
We're here today to support the Cancer Association League in their drive to create cancer awareness Access Bank, as you all know, as part of our corporate social responsibilities, we intervene in health, education, the environment, and so on and so forth.
South Africa Global is always ready to support the Cancer Association League in the Gambia. In kind, financially, in person. We're here today to show that we're part of this, and we're ready to do even more for as long as we can.
The Gambia Red Cross Society is also here to support that, and then we have our volunteers who are supporting them in the screening and all those things. And also we have our G+, emergency response service ambulances, to provide any support to them in case of when there is a need for evacuation or whatever services that may be needed, especially when it comes to medical emergencies.
We also have nurses who are here to help us, and lots of volunteers who are here to help make the process smoother. Thank you to all of our sponsors. We could not have done this without you. This is very personal to me as a cancer survivor, and to see women come out and take hold of their health, it's a good thing to see.
This screening here that is happening today, it shows that women want to prioritize their health. It shows that women want to be tested. It shows that women want to take their health into their own hands.
Some of them have been here as early as 5 o'clock in the morning to get screened, so it looks good, and it tells that they are very interested in their own health.
I am pleading with our stakeholders, and especially the government, to really see this as a call to action for all of us to come together and work on creating a comprehensive plan that will support cancer treatment in the Gambia.
Women's lives matter. Yes, women's lives do matter.